Namaskar. Today we will study drugs causing hematologic toxicity. So, hematologic toxicity includes anemia, leukopenia, thrombocytopenia. So, anemia there is a decrease in RBC, leukopenia there is decrease in WBC, and thrombocytopenia there is a decrease in thrombocytes or platelets. In anemia, we'll discuss aplastic anemia and hemolytic anemia. So there are many drugs which cause bone marrow suppression, and that leads to aplastic anemia. And many drugs like chloramphenicol, quinacrine, oxyphenbutazone, phenylbutazone, the chemical benzene, of them cause aplastic anemia. Now we'll discuss hemolytic anemia. Drugs like primacoin, methyl dopa, they cause hemolytic anemia. Let us discuss primacoin induced hemolytic anemia. Primacoin causes hemolytic anemia in glucose 6-phosphodehydrogenase deficiency. So RBC, there is no mitochondria in red blood cells, and we know this glutathione in reduced form is required, because this reduced glutathione is an endogenous antioxidant and protects red blood cells against oxidative stress. So the oxidized form of glutathione, that is the disulfide form, is converted to the reduced form, that is the sulfhydryl form, SH form, in presence of NADPH. And this NADPH is generated only by pentose monophosphate shunt in presence of glucose 6-phosphodehydrogenase, because RBC doesn't have any mitochondria. So when there is glucose 6-phosphodehydrogenase deficiency, the red cells cannot regenerate NADPH, and there will be no regeneration of NADPH, and because of that there will be hemolysis. And what happens? This primacoin causes hemolysis in those persons who are glucose 6-phosphodehydrogenase deficient. And this NADPH is depleted by the metabolic derivatives of primacoin. So NADPH is depleted, there is no regeneration of NADPH, and the persons are glucose 6-phosphodehydrogenase deficient, because of which NADPH regeneration is not there, and whatever NADPH is there, that is depleted by metabolites of primacoin. So in those persons there will be hemolytic anemia. Then leukopenia, there is when there is decreased number of WBC, we call, or white blood cells, or leukocytes, we call it as leukopenia. And WBCs we know can be of two types, granulocytes and agranulocytes. Granulocytes are the cells with granules, and agranulocytes are the cells without granules. And granulocytes are of three types, eosinophil, neutrophil, and basophil. And the monocyte and lymphocytes are the agranulocytes, monocytes and lymphocytes. So there are drugs which can decrease the granulocytes, and they are called, that condition is called agranulocytosis. And drugs like phenylbutazone, sulfonamides, sulfonylureas, antithyroid drugs, and other group of drugs, atypical antipsychotics like clozapine, they all produce agranulocytosis. And Neutropenia is decrease in neutrophils only, and most of the anti-cancer drugs cause neutropenia. So when there is leukopenia, there will be symptoms like fever, sore throat, chills, rash, and secondary infections. Next, the hematological disorder is your thrombocytopenia, and many drugs are there which can decrease the platelet number and cause thrombocytopenia. Drugs like aspirin, phenylbutazone, ibuprofen, heparin, penicillin, dextran, alcohol, clofevrate, and the cytotoxic anti-cancer drugs. All these drugs produce thrombocytopenia. This is all about the drugs producing hematological toxicity. Thank you.